Hi, my name's Gina Rowe. I'm an assistant professor and family nurse practitioner at the University of Maryland School of Nursing.
Hi, my name is Heather Congdon. I'm the assistant dean for the University of Maryland School of Pharmacy at the Shady Grove campus, also an associate professor, and serve as the co-director for our university's Center for Interprofessional Education.
Our Interprofessional Team Care Clinic team would like to thank both the National Center for Interprofessional Practice and Education, as well as Dr. Georgie Thibault as the recipient of the Georgie Thibault MD Nexus Award for single system implementation for 2020. We are both humbled and honored to receive this award, which celebrates exemplary interprofessional collaboration where practice and education connect in the health system. Dr. Thibault has been a leader in interprofessional education and practice through his commitment to this important process of care delivery to improve patient care. Our interprofessional team care clinic began as a pilot at one clinic, but quickly took off in large part as a result of being selected for the National Center for Interprofessional Practice and Education Accelerating Interprofessional Community-Based Education and Practice Award. Through this award, our team was a new health system practice partner, Holy Cross Health Network, and expand our interprofessional team care clinic to 2 additional outpatient clinic sites. Through feedback from our practice partner, the clinical focus of our interprofessional team care clinic has been patients with uncontrolled diabetes as well as a confirmed or suspected psychosocial condition. Students from pharmacy, doctor of nursing practice, social work, and nutrition see underserved, complex medical patients as a team to provide medication, nutrition, and chronic disease education, medical management, psychosocial triage, and assistance with access to community resources. Our team was able to participate in several National Center for Interprofessional Education and Practice programming activities and receive guidance and mentorship towards best practices for both interprofessional education and practice.
Our interprofessional team care clinic has had overwhelmingly positive results for both the patients served as well as the student participants. During a data collection window between 2017 and 2018, patients that participated in the interprofessional team care clinic had a reduction of their hemoglobin A1C from an average of 11.1% to an average of 8.9%. Additionally, the number of emergency department visits decreased significantly. Other clinical parameters such as blood pressure and lipid panels also improved. Students also demonstrated benefits from participating in the interprofessional team care clinic. Nearly 130 students have had the opportunity to participate in our interprofessional team care clinic at one of our participating sites. All students have been asked to complete the team skills scale prior to orientation for the clinic, as well as after their last day of participating in the clinic. Results have shown significant self-perceived improvement from students on their behaviors as it pertains to working within an interprofessional team. In addition, our team has had a lot of lessons learned. We've learned that collaboration is important not only among participating disciplines on the academic side, but also equally, if not more importantly, with the healthcare community partners. Cultivating and including leadership from collaborating healthcare organizations is critical to gaining buy-in and support for successful programs. Another lesson learned pertaining to the interprofessional team care clinic itself was that we have a primarily non-English speaking patient population with complex medical and social needs. So visits have often been very lengthy. As such, we developed and implemented a flow sheet tool, as well as structured pre-visit huddles among student teams to help make the visits more efficient. Then in March of this year, our interprofessional team care clinic locations had to cease patient operations. Community partners stopped allowing students at our sites, all as a result of COVID-19. Since then, our interprofessional team care clinic has brainstormed ways to continue to provide meaningful patient care while engaging students on their clinical rotations. As a result, starting this fall, the team will begin seeing interprofessional team care clinic patients via telehealth. We will continue to serve the same patient population, but send each patient a diabetes self-management education package with materials for use during visits. Looking to the future, our interprofessional team is continuing to look for ways to improve outcomes and efficiencies, such as collaborative practice agreements between our nurse practitioner and pharmacist, as well as interprofessional team care clinic templates to define roles of the members of the team and items to cover during each visit. Additionally, we have several members of the team that have additional lessons learned to share.
Good day. I am Phyllis Fatzinger McShane, the Dietetic Internship Director at the University of Maryland in College Park. Participation in the Holy Cross Interprofessional Clinics has provided our dietetic interns with both the opportunity to learn from our clients and to provide medical nutrition therapy, often via an interpreter, as most clients are native Spanish speakers. As part of the Holy Cross Interprofessional Education Team, our dietetic interns are able to integrate medical nutrition therapy education into a larger, more effective, holistic client-centered approach to care. Further, this clinic allows dietetic interns to develop stronger working relationships with fellow social work, pharmacy, and nurse practitioner students, and enhances everyone's understanding of what each team member can contribute to foster optimal client care. Thank you for this award.
The Holy Class IPE project brought together key educators and providers to coordinate the care of clients with multiple health and social challenges. The work of this dedicated team has demonstrated consistent, positive patient outcomes. This initiative provides evidence that IPE does make a positive impact on our patients' lives. Thank you for this recognition.
When you're working in an interprofessional care team, you're both an active participant and an observer of your other practice partners, of your patients. You're hearing, you're reflecting, you're observing their perspective. And from that dynamic, what I've gained is an enhanced perspective, a broader lens for me to think about who and what is needed to improve patient outcomes.
Hello, this is Barbara Nathanson. I'm a faculty member at the University of Maryland School of Social Work, and I am delighted to be part of this team that received this award. Thank you very much. One of the things that I've learned over the last few years was that the importance of the team cohesiveness. From that I mean that the team members, the students and faculty together get to know each other's strengths and areas that they may be challenged by. This helps build confidence and gives a lot of information to the client or patient when they first walk into the room and see all of us working together. The other thing that I've learned is that most of the professions, or all of them actually, are more alike than different. I love to see our students working together, for example, for a common goal. It may be a pharmacy and social work student that are looking at reduced cost prescriptions for our patients, or maybe looking for food resources, or perhaps looking at mental health resources and asking similar questions. I'm delighted to be part of this team, and thank you very much.
Thank you again to the National Center for Interprofessional Practice and Education and Dr. Georgie Thibault for this award. We are truly appreciative of your support.